Om Swastiastu, good afternoon everyone. We are from SGD B10 and today we would like to present our student project with the title Immune Thrombocytopenia Purpura or ITP. These are our group members and my name is Nandhita Naaz with the last digit of the number 189. And now I would like to explain about the background information of our student project. Immune Thrombocytopenia Purpura or ITP is an autoimmune mediated disorder that causes a decrease in the number of platelets. ITP can affect anyone regardless of gender, race, and age. Before a diagnosis of ITP is made, it is important to rule out any other autoimmune conditions or infections that are accompanied by thrombocytopenia. Through an analysis of the patient's medical history, physical examination, and laboratory tests, the condition can be definitely diagnosed. Making the right diagnosis is an important skill for good patient care and avoiding life-threatening complications of ITP. That's all from me. Thank you.
Good morning, my name is Nyoman Medhira with the last digit of study number E070. Now I will explain about the problem foundation. Based on the information above, the formulation of the problem is obtained. First, what is the definition and epidemiology of immune thrombocytopenia purpura? Second, what is the etiology and pathophysiology of immune thrombocytopenia purpura? Third, how to make the diagnosis and differential diagnosis of immune thrombocytopenia purpura. Fourth, what are the complications and prognosis of immune thrombocytopenia purpura? Fifth, what is the treatment for immune thrombocytopenia purpura? Next, I will explain about the objective. First, the general purpose is to determine immune thrombocytopenia purpura. Second, the specific purpose, to know the definition and epidemiology of immune thrombocytopenia purpura, to know the etiology and pathophysiology of immune thrombocytopenia purpura, to know the diagnosis and differential diagnosis of immune thrombocytopenia purpura, to know the complication and prognosis of immune thrombocytopenia purpura, and last, to know the treatment for immune thrombocytopenia purpura. Next, I will explain about the benefit. The benefit of writing this student project is to demonstrate and learn clinical science about immune thrombocytopenia purpura. We will also review immune thrombocytopenia purpura through the student project to see if there is anything that needs to be improved or studied further. This student project will also help undergraduate students to learn more about the clinical knowledge required as medical professionals. We hope that this student project will contribute to academics in the future. So that's all from me. Thank you.
Thank you for the opportunity. My name is Putu Bintang Kirana with 3 last digit number 033. I will explaining regarding the definition of immune thrombocytopenia purpura or ITP. So ITP is an autoimmune condition with a decrease in platelet count to below 100,000 per microliter, which lead to an increased risk of bleeding. So besides immune thrombocytopenia purpura, ITP has other abbreviation, which is idiopathic thrombocytopenic purpura and immune thrombocytopenia. So the abbreviation that we use in the present is immune thrombocytopenia because there is an already known cause for the ITP, which is by the mediation of the antibody system. So it cannot be called idiopathic anymore. And also, the majority of ITP patients don't have symptom of purpura or bleeding. So the usage word of purpura in ITP don't mean exactly right. And next is the classification of ITP. So based on the cause of ITP, ITP can be classified into primary, which means the ITP condition is primarily caused by thrombocytopenia, and secondary ITP, which means the ITP condition is caused by another underlying disease. In addition, the ITP also can be classified based on the duration of the disorder, which is newly diagnosed from under 3 months, persistence from 3 to 12 months, and chronic from longer than 12 months. That's all from me. The next part will be explained by my friend. Thank you.
Next, I will explain about epidemiology. Before that, let me introduce myself. My name is Putu Indriati with last three-digit number 231. Immune thrombocytopenia purpura is an acquired autoimmune condition that results in isolated thrombocytopenia and the bleeding that follows. In the United States, approximately 60,000 people are affected by CITP, almost 3 times as common as hemophilia. There are no clinical or laboratory parameters that can be used to make a diagnosis of CITP. Instead, the diagnosis is primarily based on ruling out other causes of isolated thrombocytopenia. Due to a lack of studies and varying symptoms, it is difficult to determine the prevalence of CITP. However, the most accurate estimation of the prevalence of acute ITP in children ranges from 1.9 to 6.4 per 100,000 children annually, while the prevalence in adults ranges from 1.6 and 3.9 per 100,000 adults annually.
My name is Indyarwan Ananta Seno with last digit name 091. Etiology. The ITP is an autoimmune disease, therefore the cause of ITP is mainly because of the destruction of platelets by the antibody via antiplatelet antibodies, and this also affects the megakaryocytes of bone marrow. ITP etiology can be divided into two, primary and secondary, which primary is characterized by isolated thrombocytopenia, and the secondary one is caused by other disorders such as systemic lupus erythematosus, chronic hepatitis C virus, and etc. The immune thrombocytopenia that occurs in neonates is mostly cause of ITP. Therefore, ITP in pregnant women not only destroys the platelets of the mother, but also the platelets of the fetus. A recent study discovered that SARS-CoV-2 vaccine can induce ITP via the human adenoviral vectors, with complex mechanism involving macrophage, endothelium, and platelet mediated by von Willebrand and P-lactin. It is stated that this can happen because the patient itself may have a pre-existing autoimmune coagulation disorder that just had been discovered by the administration of the SARS-CoV-2 vaccine. That's all from me. Thank you.
Okay, my name is Gusti Agung Librawan Darmalaksana with the last digit of name R09. I want to explain about the pathophysiology of immune thrombosis purpura. The condition of immune thrombosis purpura is caused by immune dysregulation. This immune dysregulation arises from the development of immunoglobulin G autoantibodies that target the structural platelet membrane glycoprotein 2B3A. This makes platelets susceptible to phagocytosis by splenic macrophages and Kupffer cells in the liver. Also, anti-megakaryocyte autoantibodies are formed, so the ability of megakaryocytes to produce thrombus is reduced and thrombocytopenia occurs. I think that's all for me, and the next will be explained by my friend. Thank you.
First, let me introduce myself. My name is Febryano Adi Prawira with the last three digits number of 156, and I'm going to explain about the diagnosis of ITP. Diagnosis of ITP is done by exclusion, which is why it is important to rule out other underlying conditions that may cause thrombocytopenia. The first step of diagnosing ITP is to do history taking. History taking may reveal a history of mucocutaneous bleeding with the appearance of petechia. During history taking, it is important to ask about the history of past infections, prior drug use, family history, vaccination history, and other underlying conditions. The next step of diagnosing ITP is to do physical examination. Physical examination typically reveals petechia in children. However, in adults, it may reveal petechiae, purpura, and ecchymosis on the extremities. The presence of petechiae, purpura, or ecchymosis may indicate that mucocutaneous bleeding has occurred. If during physical examination, lymphadenopathy or hepatosplenomegaly is found, it may mean that the patient is currently suffering secondary ITP. The next step on diagnosing ITP is to do laboratory examination. The first test that can be done is a complete blood count or CBC. Complete blood count typically results in thrombocytopenia with no other abnormalities. The next test that can be done is a peripheral blood smear. Peripheral blood smear shows a decrease of platelets and the absence of black cells. It also shows a normal morphology of white blood cells and red blood cells. If other abnormalities are found in peripheral blood smear, it may indicate that thrombocytopenia is caused by other underlying conditions. The next test that can be done is a bone marrow aspiration. Bone marrow aspiration is rarely done, but it is indicated if treatment fails to show response or if patients show signs of malignancy. Other tests that can be done are HIV test, hepatitis C test, coagulation studies, and immunoglobulin tests. That's all from me. Thank you.
Hello, my name is Gede Basudewa Wikanjaya with last three digits of my student number is 139. Now I will explain you about the differential diagnosis of immune thrombocytopenic purpura. So basically, we can determine the differential diagnosis of ITP based on the etiology of the disease itself. As we know, thrombocytopenia can occur due to increased platelet destruction or decreased platelet production. So from the assessment, if we found that thrombocytopenia occurs due to increased platelet destruction, the differential diagnoses are between idiopathic thrombocytopenic purpura, secondary autoimmune thrombocytopenia, drug-induced immune thrombocytopenia, post-transfusion purpura, neonatal immune thrombocytopenia, or HIV infection. Meanwhile, if from the assessment we found that the thrombocytopenia occurs due to decreased platelet production, the differential diagnoses are between bone marrow suppression by drugs, alcohol, toxin, and infection, aplastic anemia, leukemia, and other bone marrow cancers, megaloblastic anemia, refractory anemia, pre-leukemia, or hematopoietic dysplasia. That is all from me. Thank you.
My name is Gede Renathan with 3-digit last number is 193. And now we'll explain about the complication of ITP. There are a lot of complications for immune thrombocytopenia purpura, but the most severe is hemorrhagic bleeding. Hemorrhage is the most serious complication, and the one with the highest risk is the intracranial hemorrhagic. In children, hemorrhage mortality is 1%, and in adults, it is 5%. Adults with ITP are at a high risk of serious hemorrhage, especially if they are elderly or have a history of bleeding. In a pregnant woman with ITP, antiplatelet autoantibodies attack the patient's own platelet as well as fetal platelets that have crossed the placenta. This phenomenon may cause neonatal thrombocytopenia. Consequently, the risk of intracranial hemorrhage in the newborn may increase. Pregnant patients with ITP also have greater risk of heavy bleeding during delivery.
Hello, doctors and friends. My name is Novea Indratmo, and the last 3 digits of my student number is 119. Now I'm going to explain about the prognosis on ITP or immune thrombocytopenia purpura. In adults with acute ITP, they have a generally spontaneous recovery. That means there's a generally good prognosis for these patients. However, for chronic ITP, the patient commonly relapses, so treatment is almost primarily necessary for the good prognosis of ITP. During the treatment using steroids, 20% of the patients have a complete response to the treatment, while 60% of the patients have a partial response to the treatment. The prognosis of children and adults are different. In children, patients with ITP recovers from 3 to 6 months, and only 10 to 20% of children progresses from acute to chronic ITP, which is characterized by thrombocytopenia for more than 12 months. In children under 10 years old, they are more susceptible to remission in the patients with chronic ITP, compared with the children over than 10 years old. Continuing on the prognosis, the mortality rates are low for ITP, and even if it happens, it is caused by catastrophic bleeding like intracranial hemorrhage. There are also risk factors of developing chronic ITP as follows: older age at initial diagnosis, less severe thrombocytopenia at initial diagnosis, gradual onset of symptoms, absence of preceding infection or vaccination prior to ITP diagnosis, and also the absence of mucosal bleeding at presentation. That is all from me, and the next part will be continued by my colleague. Thank you.
Let me introduce myself first. My name is Zafira Kumala Dewi with last 3 digit of student number is 122. Now I will continue the explanation about treatment of ITP. Immune thrombocytopenia purpura or ITP is a syndrome when autoantibody count the platelet, resulting in shortened lifespan of platelet in the circulation and decreased number of circulating platelet. So therefore, the goal of treatment of ITP-SF is increasing the level of platelet counts into normal. ITP may relapse in a year after successful treatment or surgery and has no cure. Until now, corticosteroids still have become the first line of drug choice for initial management of acute ITP. Corticosteroids such as prednisone or high-dose dexamethasone can reduce the platelet destruction and reduce bruising and bleeding by adjusting the integrity of the endothelial cell to facilitate primary hemostasis. If the clinical presentation, patient age, or other findings are atypical for acute ITP, performing biopsy and bone marrow aspiration should be considered to confirm the diagnosis before treatment by corticosteroid. Patient with ITP for 3 months or more and didn't react with corticosteroid can be given TPORA and rituximab as the second-line option. And splenectomy could be second-line option for adult patient with ITP for more than 12 months. That's all from me. Thank you.
Okay, my name is Bitaqia Yumna Agustia with Agustia number 105. In conclusion, immune thrombocytopenia purpura or ITP is an autoimmune-mediated disorder characterized by a reduction in the platelet count. ITP can occur in children of any age, but the prevalence is highest in those between the age of 1 until 6 years. The etiology of ITP is divided into primary and secondary. The primary is characterized by isolated thrombocytopenia, while the secondary is due to the other conditions such as SLE, chronic hepatitis C virus, and etc. The pathophysiology of ITP begins with the introduction of a platelet-specific antigen into the APC until autoantibody are formed which result in thrombocytopenia. The diagnosis of ITP is carried out by exclusion, which is to rule out the underlying condition that cause thrombocytopenia. If the patient is suspect of having an underlying immunodeficiency, the primary laboratory tests that should be performed are complete blood count with differential count test, peripheral blood smear, and immunoglobulin test. Differential diagnosis of immune thrombocytopenia purpura can be seen from two aspects: thrombocytopenia due to increased destruction of platelets or caused by decreased production of platelets. The most severe complication for ITP is hemorrhagic bleeding, and the most at risk is intracranial. Generally, patients with acute ITP have a good prognosis. However, patients with chronic ITP usually relapse. The first-line drugs for the treatment of the patient with acute ITP are corticosteroids. Corticosteroids work by reducing the rate of platelet destruction, reducing bruising and bleeding. Okay, that's all from SGD B10. I hope this presentation has given us new insights. Thank you for your attention.